I'm still in awe and very honored to receive the award. It was quite an honor to do that, and have to thank the committee, the American Nurses Association, as well as the Daisy Foundation, and also my nominee, my nominator, I should say. Um, but I think, what really got me involved in ethics when I started my career in nursing, which was decades ago. I really was very interested. I took a course in my bachelor's program related to ethics. And it was fascinating because at that time we were going through many changes in terms of Karen Quinlan and some of Nancy Cruzan and some of the major social kind of upheaval, civil rights movement, women's movement, etc. But I was really interested in ethics and understanding better about the decisions that patients make, the decisions that our staff makes in terms of our medical teams. And so then I took a lot of additional coursework in both my master's and my PhD program related to philosophy and ethics. And I was fortunate that when I came to MD Anderson 30 years ago, I was also asked to serve on the ethics committee. And so what came of that, I served for 4 years on the consultation committee. And then I was also asked to be an adjuvant ethicist, so kind of a permanent member of the ethics committee and doing some advisory work and occasionally taking ethics calls. And so I did that and as an adjuvant ethicist. And in stem cell transplant, worked in as an advanced practice nurse in stem cell transplant for many years. So if you can imagine some of the ethical dilemmas that face our patients and our staff when we're talking about life-changing treatment, as most of our cancer treatment is, but patients frequently will come to transplant having standard therapy having failed them. And then this is a situation of it's going to have a transplant or is it going to be a hospice referral. So a very vulnerable, very kind of desperate situation for our patients. So we would do what I started doing is monthly ethics rounds with the nursing staff on the unit. And we would do that at during the day, mid-afternoon, and at night for the night shift, because I thought it was important. Many times, a lot of the ethical dilemmas are faced by the nurses who work at night. And so we would discuss cases. We would have a journal, kind of journal club. We would do this monthly. So I did that for maybe 15 years or so, which was quite a considerable time. And then, of course, COVID hit, and then we had to change the format a bit. But 2 years ago, then I was asked to switch roles. And so I gave up my role as an advanced practice nurse in stem cell and just went to the ethics role. So considered a clinical ethicist. I had to take the consultation examination to get the HEC-C, the Healthcare Ethics Consultant certification, which is the exam for that. But I felt like nursing, and the reason that I was hired by Nico Norkia, who is our executive director, was because really to promote nursing. And nursing is a moral discipline, just like medicine is a moral discipline. And so almost everything we do has some implications related to ethical issues, whether it be teaching patients so they can make, autonomous decisions, or whether it was offering more treatment or whatever we do in ethics, passing medications and making sure the patient understands what those medications are for. So almost everything we do in nursing and in medicine, has some implications related to ethics. And so I felt privileged to be asked to join the ethics group where there's 6 of us now, ethicists who work at MD Anderson. And we do a lot of education, a lot of teaching, some research. We're doing some research right now on a program that I started when I joined the Ethics Center on ethics in nursing practice. And so we're promoting nursing, being more involved with ethics. And one of the ways that we decided to initiate that was to start a clinical ethics resource nurse role. Our goal is that we will have a nurse who is had received more education. We do a 6-month certificate program in clinical ethics, which is open to physicians, social work, et cetera, not just nursing. But we do this program, and at the end of that program, then they start their role as a CERN, or a clinical ethics resource nurse, on their units. Our goal right now, we have 13 units and 13 specially trained resource nurses. And our goal is really to have a resource nurse in every clinic and in every unit in the hospital. Someone who can answer questions that nurses have, identify, increase sensitivity and awareness of ethical issues, and do some preventive ethics. So before, as my boss says, Nico says, before the house burns down, before we're having to make those very tough decisions, should they go to ICU? Should they be intubated? Those type of decisions. So the process is really to promote nursing. And as we all know, nurses spend the most time with patients at the bedside, if we're talking inpatient, and sometimes receive privileged information that the patient may not share with the physician or the medical team. And so really to really encourage them to talk more with patients and to really explain different things. So that's a little bit about, but I'm so happy with the program because our CERNs now, or clinical ethics resource nurses, we've done some research looking at moral distress and ethical climate on the units that they work. And right now I presented 2 posters. One will go present at Oncology Nursing Society next month. And then of course we're going to publish our information, our quality improvement project that they're involved in. This was the second year that Daisy Foundation and American Nurses Association, ANA, joined together to present this award for leadership and as well as practice. And as I said, I was so honored to receive that. And my colleague, another nurse, Lisa O'Brien, received the practice award in ethics. But it's really great to have that highlighted and be able to, in this interview today, as well as being able to have it published in Cancer Nursing Today, uh, and and really getting the word out there that these things are available, these awards are available. And there's many, many, many nurses and nurse leaders I know who are certainly recipients, could be recipients of this award.